Hello, and welcome to Community Alliance for the Homeless's agency-based training on mental health and homelessness and many of the intersections that we see in the work that we're doing daily within our community. We are so happy to present this training. None of us at Community Alliance pretend to be mental health experts, but we do work with individuals who have rigorous training in both mental health and social work and come from a variety of backgrounds who can help address a lot of the issues, underlying issues we see in the unsheltered population. And so today we're really excited to dive into this topic. This talk was originally given in the beginning of the year 2023 by Marissa Wissett at Alliance Healthcare Services, and we're very excited to adapt this and make this available to all our partners within the community online. This training is based on best practices in addressing mental health needs of individuals experiencing homelessness. It does not mean that it is a one-stop shop or kind of one fixed solution approach, but hopefully throughout this training, we will begin to unpack the intersection of addressing both psychosocial and kind of very biophysical needs within our community as a way of addressing some of the issues that may lead or arise from homelessness. So just to start off, we want to make this crucial link between mental health and homelessness. We know that 1 in 4 people experiencing homelessness in America's shelter system are dealing with some serious mental illness. And this is only within the shelter system. So this is not accounting for individuals who are still unhoused, unsheltered, who may be living on the street or in some kind of varied situation. But to know that the extent that 1 in 4 people are experiencing a serious mental illness within the shelter system. Mental illnesses have been identified as a major cause of homelessness in American cities, and at any given moment, there are more people with chronic mental illnesses who are experiencing homelessness than receiving care in hospitals. So this is a real critical issue that we as a community are hoping to address through services and supports. Additionally, people living with mental illnesses are more likely to be the victims rather than the perpetrators of violence. And so this statistic really kind of breaks the mold of what we hear and kind of are made to think that individuals with mental illnesses are inherently violent, dangerous. But really, we want to change that narrative and shift that narrative here and identify and communicate that often these individuals are the most vulnerable. And some of them are captured within the shelter system, but most of them continue to be unsheltered due to kind of barriers related to their mental illnesses, which can cause them to be victims of violence. There are many contributors or cofactors to mental illness in unsheltered populations. That can be things that we see in Memphis at high rates, such as poverty, substance use or abuse, previous criminal background records, or previous trauma. All of these things can contribute to the development of a mental illness, and truly, sometimes, and in our presentation, Marissa was great to bring up the experience of being unsheltered is a traumatic event, which can be very, very triggering for individuals with mental illness. So these kind of contributing factors and cofactors, they're such a delicate link between the experiences that individuals have and kind of the outcomes or the byproducts that they're experiencing. And a lot of these individuals may exist in kind of an unstable or undiagnosed place of vulnerability within their mental, kind of thinking about their mental illness. And so any situation that they encounter can really become a cofactor to experiencing homelessness. So, with all of that in mind, we want to think about, as a community and as the Community Alliance for the Homeless, what resources are available for homeless service providers to connect, individuals that they're working with to mental health services in our community. And so for kind of the rest of this presentation, I will be talking to you as service providers of how you can help as an individual and what resources are available for you to connect community members to in Memphis. So, just kind of a big takeaway, if you are someone who works with individuals who may be at risk or do experience homelessness, we want to be aware of the signs and symptoms of kind of the development of mental illness. So, whether that's excessive fears or worry or excessive anxiety. And I mean, it's hard to distill those things because those can be different. If I was experiencing homelessness, I would feel very anxious. I would have a lot of fear and worries. And, what can you do as a provider to help eliminate some of those fears, address some of those fears? These are what we're looking for in a solution-based approach to dealing with some of these symptoms. But many of these symptoms can include things like concentration problems, sleeping problems, paranoia, extreme mood changes, excessive use of alcohol or drugs, inability to cope with stress, suicidal thinking, feeling sad. All of these things in some way are natural to the human experience, right? Like, we all experience problems, can't concentrate sometimes, we have trouble sleeping, something's on our mind. But when our stress level is elevated, we're in that kind of fight or flight state, the experience of homelessness can really start to trigger some of these early symptoms of mental illness. And if we're not addressing those kind of as we see them arise, or as we see a client or someone who's coming in our office starting to kind of experience these emotions or fears with great intensity, we need to be able to point them in the right direction of getting and addressing these issues and providing the services that they need. So those are just some things to be aware of. And we're dealing with people who are in very stressful situations. We don't want the situation that they're in to trigger another kind of, I don't want to say negative, but negative experience for them, right? Anyone who's having a mental health crisis, that's a negative experience for them. And so, as we're interacting with individuals, dealing with really sensitive issues, we just want to engage clients in a trauma-informed manner. So we're placing emphasis on safety. We're creating a trustworthy relationship where they can trust us, they can trust our organization. And a lot of that trust does not come from saying, hey, I'm going to help you get this, and we're going to get you in this place, and we're going to do this. But being really transparent of like, hey, this is how things work, and this is what I can provide you with today here. How can I be honest with you of there's a lot of barriers that we face even as providers, but I want to be transparent with you so you know exactly the steps that we'll follow, and that, we're going to do everything we can to help you. It may not move on the timeline that we want it to, but creating that real honest relationship, taking a very genuine and authentic approach to engaging individuals. Maybe you're connecting them with peers and stopping that isolation or that feeling of isolation from setting in. Again, this piece of collaboration as a consortium, Community Alliance for the Homeless is all about collaboration, but we want to be able to connect individuals and organizations to available resources in our community. And a big goal of this agency training that we've been doing is how can we get everybody in the same room talking about what are the challenges that we're facing, but also what are the resources available to our community. And so things like today, understanding what resources are available to my clients. Um, a huge, huge part of taking a trauma-informed approach within not only, you know, the mental health space or any kind of social service sector, but really just a human approach is how can we empower individuals to to find to be able to have choice in what they're doing, but also to find some kind of dignity for themselves. The experience of homelessness can be very humiliating, and I think as we approach clients, we need to be acutely aware that these individuals, it takes a lot of guts to ask for help. And so, how can we empower and give voice and choice to these individuals? And lastly, just being aware of some of the cultural, historical, racial, gendered issues that play out. Specifically in Memphis, we have a very deep history of racism, and how is that playing out today in our homeless sector? We need to be aware of that. So, you know, one of these approaches is great, all six of them is also great, but we're just working to create a more trauma-informed community so that our response to the issue of homelessness can be one that is united in care, empowerment, and creating a safety network for these individuals who are experiencing something incredibly difficult. At the end of the day, it is about having empathy, and I think a lot of us can have compassion fatigue. When you do this work, it's hard to have compassion every day, and so just working to cultivate empathy for that individual, that is really the root. And then you don't have to be a clinical mental health worker to have empathy for someone. And so just carrying that reminder with you that may change someone's response to you. It may open them up to receiving help that they were opposed to before. So empathy is huge. We don't realize the impact that we can make in someone's life just by the way that we're approaching and asking them what they need. So to kind of get right down to to the piece about collaboration, and the goal of this talk is to talk about what resources are available within our community. Alliance Healthcare Services, like I said, that these slides were put together by an expert in mental health, and a representative of Alliance Healthcare, but Alliance Healthcare is a no-cost mental health counseling service located in Memphis, Tennessee. They have several locations throughout the city, so it does not matter where you are. There is a place that can be close to you, that can be close to a client, to help them access the services that they need. Additionally, we have provided some other resources that you can visit, like Mental Health America of the Mid-South or the Tennessee Department of Mental Health. You can follow those links to understand more about what are kind of widespread resources, but really wanting to connect anybody who is working in kind of the homeless sector with Alliance, and letting you know that all of these services are available to our community members who need it most. And these really are essential services. So if you have any questions, please feel free to reach out to Julie at CAF.org, our planning director, or you can reach out directly to Alliance Healthcare Services, info@alliance-hs.org. We are continuously working to foster more partnerships in the community, and Alliance Healthcare Services has been a great partner of Community Alliance for many, many years. The work that they do is essential to the well-being of the Memphis community, and we are so grateful for it, but always wanting to kind of be a champion for them, be a loudspeaker for them for what they do, and send more people their way. And all of these approaches, again, like I've said, you do not have to be a mental health expert to practice trauma-informed care, have empathy, um, and just really address an individual as a whole person and see that they have a lot of needs and how can we connect them with the appropriate resources. So with all of that said, I hope that this little session has been helpful. If you have any questions, please feel free to reach out with that to us, drop a comment in the video and we will reply. Thank you all for watching and stay tuned for more videos.